Good morning from Dr. Mackay, vein and circulation specialists. Their offices. Once again, we are joined by Dr. Mackay, the doctor himself. Good morning.
Thanks for coming to see me today.
Yeah, we're in one of your surgical suites today, which interestingly enough, I said, I don't know if I can work in these conditions. I'm seeing lots of Florida Gator stuff around.
Yeah, I'm sorry. That's where I went to school, so I kind of root for them.
That's all right. I'll forgive you for that. You're doing a lot of good, though, for patients here in the Bay Area. Talk about why somebody kind of would come to your office, first of all. I mean, is this after, when we're talking about vein and circulation issues, is this something that they typically find with their family doctor or their doctor that they've been seeing for a while and they need to be referred to you? Or kind of talk about who your traditional patient is.
Well, it's really a pretty large gamut of people. Some people just notice the varicose veins in their legs and want to know what can be done about them. But the majority of my patients are referred by other physicians who they're in their office complaining that their legs are hurting or swelling, and the physician notices that they have signs of venous disease, and they frequently get referred over to us. And many times it comes from wound centers when patients have ulcers on their legs. They want to know if there's some circulatory thing that we can address that will help fix that.
Because I was talking about maybe some of the biggest misconceptions or some of the things most commonly asked questions, and it's not just a cosmetic issue of why you're seeing patients of that it just doesn't look good. I mean, this can cause some serious issues if they're not treated correctly.
Yeah, I would say about 20% of our patients are for cosmetic. The other 80% are really more medical problems. They're having pain, they're having heaviness, fatigue in their legs. Many times they've tried compression stockings, which may help some, but the symptoms are still there and still bothering them. And they want to know if there's anything else that can be done.
I was asking you, for those of us who have been pregnant, and I remember feeling that heaviness in your legs, and it's kind of like your skin is stretching, the circulation issues. Is that what typically people feel? Is that a common kind of sign?
That's definitely along the lines of what you feel. Very heaviness, the legs swell, they feel uncomfortable. And like you mentioned, you said you wore the stockings, and they do help. Yeah. And but if the stockings are not controlling the symptoms, and then they end up coming in. But that is definitely the kind of symptoms that you'll feel.
So kind of explain the process when someone does call and they say, okay, it's time to come see Dr. Mackay, come see a specialist about this. What happens? Do they need to have certain tests done before they come here? Is that something that you look at here while they're here?
Well, generally, when they call, we try and figure out if they're coming in for more of a cosmetic reason. If they do, it's a kind of a different appointment. If they're coming in because they're having symptoms, and then they'll be evaluated first, and hopefully we'll recommend something like an ultrasound that day. If they do have the need for it, and if the ultrasound kind of will tell us what the problem is and what we can do about it. So
that's the starting point. I know probably a lot of people too, kind of before we wrap up, too want to know, is this something that insurance covers?
Generally, again, it comes down as long as it's not for cosmetic issues. If it's for medical issues or symptoms, the pain, the swelling, ulcers, sores, skin problems, then they generally do cover it, but they do usually want to trial conservative therapy. That is those compression stockings. They want you to try those, see if that helps. And then, so many times when we see them, that's what we recommend first, is try those stockings, see if it'll work. But if they've already been trying them, then we may go ahead and straight to treatment.
Well, Dr. Mackay, thank you so much for allowing us to be here this morning. I know I didn't even scratch the surface on maybe some of the questions that you have at home as well. So if you have any questions, make sure to call his office, go to their website. We'll also put that info on our website, which is tbmorningblend.com.